Nevada Chiropractic, we're getting a lot of questions from people that don't understand what decompression is, how it works, and why we do it, and why we get so much success with it here in the office. This is standard lumbar decompression therapy. Dr. Welch is setting up the patient with this harness that's going to anchor around the pelvis, and then once the patient lies down flat, there'll be another torso harness that's going to be attached to the table. These rings down here are going to be attached to a mechanism in the table that's going to allow that decompression force to be applied. All these decompression tables, there's 4 in this room that have different options. This one is great for just the standard sore low back, disc pain with pain going down the leg. This table over here is able to help people who are unable to do what this patient just did, to transition down on their own, under their own body weight. So a patient can stand on this table, and then there's a button we can push to recline the table down so the patient doesn't have to make that twisting motion. Now that the patient's getting strapped in, we want to get as much pressure off of that disc as possible. That's the name of the game with decompression, is taking pressure off the disc. So we raise the knees, and that takes pressure off of this lumbar spine. Then when we apply force with the machine, we're able to gain traction, decompression. Gravity is the enemy of chiropractors. All day long, your spine is subject to gravitational force, and we're trying to reverse that to get some relief for the patients. We get great success with this. If the patients are able to go through a few of these series of treatments, we're able to fix a lot of decompression without drugs or surgery. There's another option for decompression over here. This is the Ergoflex Back on Trac. It's a simple table that doesn't have a harness. Some people can't handle that pressure around their beer belly or their abdomen. It just hurts. So they lay back on this one, and this one grabs the traction from underneath the armpits, and that allows the knees to be over here, just like this. The patient would be strapped in with the feet, and then the table will recline back, and then we can apply about 75, 80 pounds of force to the back. This is a very, very good option for elderly people or people who just can't handle that pressure on their stomach. Maybe they ate a big lunch, and we don't want to squeeze down like you just saw on this table. Over here we have our cervical decompression, and this is the best for pain that's going down the arms. When a patient has like a stinging, sharp, zinging pain down the arm, we use cervical decompression. So this unit, the patient's totally relaxed. We have a little harness that goes around the neck, and then that strap that comes up over the forehead, that keeps the head from flexing forward. And then when we set the parameters for the table, we're able to go up all the way to 50 pounds if needed, but most patients don't need that. Around 35 to 40 pounds PSI is what we use for about a 15-minute treatment on the cervical spine. Usually after just 1 or 2 treatments, patients are feeling a lot better, and that pain's coming up out of the hands, and they're getting back to just a little bit of stiff neck, and then we can fix that with just the adjustments. This table is designed to treat cervical radiculitis, or pain that's coming from the nerve root, spreading down the arms, causing tingling, numbness, and weakness in the hands.